Hello, my name is Kathleen Volman, and I am a clinical nurse specialist. There is a saying, if the only tool you have is a hammer, then everything begins to look like a nail. It's quite the opposite for how a clinical nurse specialist thinks. We think outside the box, which is exactly what our healthcare systems, communities, patients, in fact our nation needs. As CNSs, we're thought of as part of the solution. Our appointments to leadership positions are based on an advanced degree, a master's or a doctorate in clinical nursing, and with expertise in a specialty. From the bedside to the boardroom, we are uniquely qualified to coach, mentor, and apply evidence-based clinical advice from a big picture point of view. That's why many of our nation's 72,000 clinical nurse specialists are called on to help guide their healthcare systems through magnet designation. Our unique, one-of-a-kind skill set is an identical match for this leadership challenge. In fact, the American Nurses Credentialing Center publicly endorses this role for the CNS. Maybe we're selected for these kinds of roles because of the ripple effect caused by our influence. I like to think of the image of dropping a pebble in a pond. To put it simply, we design clinical standards based on evidence. We assist the entire clinical team, for example, to take a disease-managed protocol and implement it. It then moves from the bedside to system-wide, ripples outward to community-based settings, and maybe even turns into a model for health systems nationwide. This innovation, in turn, becomes a standard. How exciting as we develop and implement models for improving clinical outcomes and safety, models for eliminating unnecessary care, models for improving care for those with chronic illness, and solutions to reduce cost of care. This is the daily work of CNSs. An exciting era of growth and opportunity is our next call to action. Studies demonstrate that we help to prevent patient injury and readmissions by leading our clinical teams through evidence-based system-wide changes to reduce infection and medical errors. As CNSs, we respond to our nation's need for increased access to community-based care by expanding nurse-managed healthcare centers, for example. Studies show that as coaches to those with chronic illness, we promote a heightened sense of self-care, which reduces hospital admission and out-of-control costs. And who would argue about the importance of educating our nursing workforce? CNSs educate and train nurses in all practice settings. Evidence-based training programs, clinical education, one-to-one mentoring, all are central to our charge. You see that our toolbox is overflowing. Good thing, because we need more than a hammer to build the next generation of healthcare. We need innovative solutions based on evidence. Clinical nurse specialists stand ready as partners with clinical teams, administrators, and policymakers. Let's start building. To learn more about clinical nurse specialists, send your email request to info@nacns.org. Include your name, title, organization, email address, and phone contact. Identify CNS value in the subject line.